backgrounds, including undergraduate, master's, and also doctoral students, and members of the Faculty of Public Health, as well as others joining us today. So today's event focuses on the critical topic of enhancing the use of digital health strategies in healthcare facilities. Our esteemed guest speaker, Associate Professor Dr. Usman Iqbal, will be sharing valuable insights on the subject so we can gain a deeper understanding of these strategies and their practical applications. So to commence our event, we are honored to have Dr. Budiono, Dean of the Faculty of Public Health, Universitas Diponegoro, who will share some welcoming remarks. So for Dr. Budiono, the time is yours.
Thank you very much, Mas Dion Nuridin. Assalamualaikum warahmatullahi wabarakatuh. Okay. Dear Vice Dean for the Academic and Student Affairs, Dr. Nurza Juli, and also Vice Dean for the Resources, Dr. Aprina Kartini, Head of Study Program of the Magister of Public Health, Universitas Diponegoro, Dr. Ayun Sriatmi, in this event be replaced by Dr. Cahya Trimurnami as Secretary Magister of Public Health. Assistant Professor Usman Iqbal, PhD. I don't mention full of your title. From School of Population and Health, Faculty of Medicine and Health, University of New South Wales, Australia. Thank you for coming and joining, Prof. Usman Iqbal. Thank you very much. And moderator Dion Zen, and also our colleagues, a lecturer of Faculty of the Public Health, Universitas Diponegoro. And of course, the dearest participant, this is the student of the Magister of Public Health of the Public Health Universitas Diponegoro, and all of the participants. Welcome to the seminar. Alhamdulillah. Let's praise Allah Subhanahu wa Ta'ala who has given us to thousands of efforts until today. Thank you. This event was initiated by Magister of Public Health, Faculty of Public Health, Universitas Diponegoro. The topic, I think, is very impressive and a very current issue. There is strategies to increase the use of digital health in healthcare facilities. We know that the digital health is a specific discipline that includes digital care program, for example, technology, and also health service for using the technology. And also for the life and also associated to improve the efficiency of health service delivery, of course, and make treatment more personalized, I think, and also precise. Digital health product can be in the form of the electronic health, or we call e-health, for example, and mobile health, in-health, health information technology, telehealth, or teleconsultation. We call the telehealth or telemedicine. In 2020, 2021, an ICFI, the former name is Quintel and IMS Health Incorporation, for Institutes for Human Data Science report, found that the digital health application market is shrinking. Will offer 350,000 platform now available in the internet, I think, online, I mean. I think it's because of the COVID-19 pandemic. The COVID-19 pandemic has significantly impacted the growing interest health in digital health application, and quickly forcing patients and doctors around the world to use the online health tools or platform more than ever. Increasingly advanced digital technology has been utilized by health facilities to increase effectiveness and efficiency, and of course improve the quality of services. The Indonesian Minister of Health and the United Nations Development Program (UNDP) also already launched the 2024 Health Digital Transformation Strategy Blueprint. So we also think that are there any side effects for user of online health teleconsultation, for example, teleconsultation services or other digital health services, or has the government, especially our government, prepared the regulation? Yeah, this is there are some questions that can be discussed. What is the digital health and what type, and what will implement it, and also what is the regulation to cover this platform, and etc. I think this topic will be explained clearly by Assistant Professor Iqbal Osman, PhD. Thank you very much. I think he is very understand and has a lot of experiences related to this topic, especially for discussion, especially for explain issues about of digital health. Hopefully, Assistant Professor Iqbal Osman, PhD, and the participant enjoy the seminar. Thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you, Dr. Budiono, for your welcoming words. So it is my honor to introduce our distinguished speaker. Wait. Okay.
Mas Dian.
Yeah.
Prof. Osman Iqbal, I can accompany you until finish because I have to give a lecture to my student and also exam. Thank you very much, and
really
enjoy the seminar. Thank you. See you. Thank you very much.
Thank you.
Thank you,
Dr. Budiono. Thank you.
Thank you so much. Okay. Okay. So please allow me to present Associate Professor Dr. Osman Iqbal, PharmD, MBA, PhD, and the long title. Okay, and Dr. Iqbal's educational background includes he earned Doctor of Pharmacy from the Federal Urdu University of Arts, Science, and Technology, Islamabad, Pakistan, and he also earned PhD in Healthcare Informatics or Biomedical Informatics from Taipei Medical University, and also get MBA in Healthcare Management Administration from Taipei Medical University, and also a postgraduate certificate in Global Health Informatics to improve the quality of care and patient safety from MIT. Wow. So he has an extraordinary CV from Dr. Iqbal, and also he has received numerous fellowships, editor journals, many affiliation, and also recognition. And currently, Dr. Iqbal holds the position of adjunct associate professor at the University of New South Wales, or UNSW, Australia, and also visiting associate professor and digital health consultant and global health and health security department, College of Public Health, Taipei Medical University, Taiwan. Dr. Iqbal research is dedicated to pioneering innovative approach in health information technology to enhance the quality of care and patient safety, artificial intelligence medicine, telemedicine, electronic health records, Internet of Things, virtual care models, global health informatics, and health services research. He also successfully secured many research grants, totaling approximately 3 million Australian dollar, and has mentored postdoctoral researchers and postgraduate students. His scholarly contribution include over 170 research publication in prestigious international journals, covering editorials, authored book chapters, conference abstract, and conference paper. So Dr. Iqbal has made significant contributions through invited talks, session chairs, and participation in various academic and industry events. Okay. So, let's get, wait. I will stop sharing my screen. Okay, so let's create the speaker and check if he is ready to begin. Hello, Dr. Iqbal. May I kindly confirm if you are ready to start your presentation?
Thank you so much, Dan, and Dr. Chayatri, and also the Dean for the remarks. Assalamu alaikum, everyone. It's really great pleasure to interact with all of you. Can you all hear me clearly and can see the slides clear?
Yep. Okay. The slide is clear. But I'm sorry. Before we start.
Yep.
Okay. So for all audience, I encourage you to actively engage in today's event. Please take notes on important points from the presentation and prepare your questions for the upcoming discussion and Q&A session. You are welcome to use either English or Indonesian to ask your questions. And Dr. Iqbal, we have approximately 2 hours for your presentation and the following discussion. We aim to conclude this event by 3 p.m. Indonesian time or 7 p.m. Sydney time. So please feel free to proceed with your presentation. Thank you.
Thank you again, and Assalamu alaikum. Thank you for the nice introduction. It's really a pleasure to interact with all of you. As Dan already mentioned, that please feel free to ask questions, prepare your questions, or you can interrupt or stop in the middle, or if you feel like there is some question relevant to specific slide, you can post in the chat as well. So I will stop and explain more in detail, and then we can also have a discussion at the end too. So it's more like an interactive session instead of just I'm going through. Please feel free without any hesitation. So today I'm going to talk about strategies to increase the use of digital health in healthcare facility, which is very important. As you know, the Professor Dean mentioned before in the introduction, that after COVID, a lot of things happened. Before COVID, there was people were using the digital technologies, but not very much familiar with the technology. So for example, telemedicine is not new. This has been done 10 years back. I remember we doing these projects in 2012 in the remote areas. But what happened in after COVID is even the well-developed areas and well-developed countries need to do that, you know, the telemedicine and those kind of initiatives as well. And also, you might also knew that, you know, the people start working from home, and they also had, you know, the other opportunities where some of the technologies have opportunity for people to boost their businesses or to improve the healthcare or to have the more virtual care services. On the other hand, somewhere where there were limitations that you can't do that, you know, in-person things. So you already have my introduction. Thank you again for the nice introduction. I've been involved with the journals as well from the different perspective, and also some of the organizations where I have an opportunity to work with them and to learn from them. From the healthcare and quality perspective, from the health services management perspective, and from the health science and informatics perspective too. So you can imagine that, you know, I have a multidisciplinary kind of background. And why it is important, I will tell you later, because you know how this multidisciplinary help you for the digital health side as well. So today we are going to talk about, you know, the digital health landscape and what are the benefits of digital health and the barriers to adoption, and key strategies which we can adopt for having the good digital health initiatives. Some of the success stories I can share with you, some of the challenges and what are the solutions for them, and future trends, and the conclusion at the end as well. So when we talk about the digital health landscape, so we also, you know, we knew that there are so many different kind of terminologies people use. Electronic health records are one, telemedicine, wearable devices, mobile applications, IoT devices stands for Internet of Things devices. And then there is a AI-driven solutions. AI stands for artificial intelligence. So because we have a lot of data nowadays and the technologies, so a lot of data, when you have a lot of data, then what you can do is to build some kind of, you know, the algorithms to develop some, you know, models, which can help you to improve your healthcare. And then we have the diverse range of applications from remote monitoring to diagnostic as well. So nowadays you can see that, you know, there are some applications which can help to automatically identify from the X-rays whether this person has some specific respiratory disease out of the X-ray. So you don't need to have the radiologist for looking into that manually. The solutions are already in the market and research as well. And then there's a potential for patient empowerment as well and improve the care coordination. You know, since after COVID, of course, people are more aware of the digital health and the technologies, though these technologies are not new as mentioned. So the health IT, you know, was there for a long time, and AI was even for several years back too. But it just got into limelight after the COVID when something happened. So I'm just giving you a little bit overview on that, what is exactly the digital health. So digital health is actually a broad term that encompasses the use of digital technology. So any digital technology which you are using, you know, to improve the healthcare is actually called as, you know, the digital health. So that is going to help you to improve your healthcare. And any information or communication systems or any electronic health records or tools to enhance healthcare delivery or improve the patient outcomes and promote the overall well-being. So it includes a wide range of applications. For example, electronic health records, mobile health applications. People, they have, you know, different applications for different purposes. For example, for their healthy diet monitoring, wearable devices. People are using Apple, you know, watches or some other devices, Fitbits, to monitor their healthcare. Telemedicine is there. It was for remote monitoring, but now people are even using in the well-developed settings because of the, you know, workforce limitation and also because of the opportunities they have. And the various digital solutions are designed to support advanced healthcare services as well. So definition of electronic health record is, you know, that the electronic health records are digital versions of patient paper medical charts. So before, you know, or still in some hospitals, people use the medical charts, which are paper-based, and those paper charts were developed into, you know, electronic form in an electronic health record format. So where you can have the complete patient's medical history, which includes the diagnosis, medications, treatment plans, and medical test results and other relevant health information. And then AI-driven solutions. So as I mentioned, AI means artificial intelligence here. So AI-driven solutions are the applications and systems that use artificial intelligence algorithms that can help to analyze, process, or make decisions based on the data. Because we have a lot of data these days, so that's why we need these kind of advanced tools. Because a lot of data you cannot use to analyze just using the manual machine. So you need to use the advanced computers to help to tackle those, you know, how large amount of data. So AI can help healthcare providers and researchers make more informed decisions and improve the patient outcomes as well. Then telemedicine. So telemedicine refers to practice of providing medical services and consultations remotely, typically through video conferencing, phone calls, or online messaging platforms. It is very challenging in some settings, including in Australia, where they have difficulty to find sometimes the GPs, so they have to call some, the online telemedicine services to get consultation. Then wearable devices. So wearable devices are electronic devices that can be worn on a body, such as smartwatches, fit tracker, or other gadgets, which can help you to monitor your healthcare in a different perspective. And then we also have a mobile application. And mobile applications, is actually the short form of applications or softwares, programs that are designed to run on your mobile devices or smartphones or tablets. So those mobile applications could be for your, like for example, people doing the exercises. So there are different exercises, and they can help to monitor their, heart rate, their respiratory rate, and their other, the vitals. That help them to improve their healthcare. So for example, like the patients with diabetes, they can also monitor their lifestyle using those particular apps that can help them to improve their lifestyle and stay away from getting more, the serious disease. And then IoT is Internet of Things devices. Our physical objects actually is kind of like sensors or any softwares or any network connectivity that enable to collect and exchange the data with other devices or systems over the internet. This is mostly people use in their residential care services or in the aging care, or the aged care centers where there are very elderly or old people, the population, and you don't have much resources to take care for them longer time. So you need to have some assistance from the devices where, they can collect automatically the data and to develop some algorithms which can help to monitor and predict, for example, like fall detections, some other cardiac, diseases, these kind of things. So the benefits of digital health is actually, not just we can say in a single way, we can say, it can help to improve patient outcomes, but it's more than that. So just looking into improving the patient outcomes, for example, the few examples are, for example, reducing the hospital readmissions and better chronic disease management. So having just to reduce hospital and readmissions, what that means is that if the patient already got a surgery from the hospital, and if they have to have the revisit, maybe some of the patients, they don't require to have a revisit. They can only have the consultation. They don't have to travel all the way to the hospital if they're living far. And some of the patients, if they are with the complication, they might need to visit. So you can able to classify based on that, and also able to allocate the resources based on their needs as well. And the better chronic disease management is also, as mentioned, that they can use some mobile devices, some other variables which can help them to monitor the good outcomes. Enhanced patient engagement is also very important because the patient, because the patient are the one main in the center, the consumers, right, for the healthcare services. So they have to take a responsibility or be an active part of their own healthcare management plan as well. So you have to involve the patient in that as well. So in the digital health, this is very important that you also have a good involvement from the consumer perspective as well. So they can, be a shared stakeholder in improving the healthcare together. So for example, is if any patient with a complication, let's say hypertension, if the doctor prescribed them a medicine and the patient go back to home, and the patient taking medicine for one day maybe and missing the second day, right? The doctor cannot all the time keep a record of that, because doctor cannot be staying with the patient all the time. So they can't monitor them every time that whether the patient really took the medicine or it's just, saying that took the medicine. So we had an interesting project which we have done on the compliance of medication as well, where we monitored the behavior of the patients. So what we did is, for the one group, we use the manual chart. So the doctors prescribe the medicine and we allow them to go back home and then take the medicine as prescribed. And the other group, we give them some of the BP monitoring devices. And we also give them an RFID card, so they don't have to log into the system. They just, because the card is their ID, so they just tap on the machine and machine will automatically record their blood pressure and send to the electronic health record of the hospital. So the difference between both groups were that the patients who were having the manual reading, so sometimes if they skip the medicine, they will just write on the chart that they took the medicine, because based on the previous habits, they just mark on that, okay, yesterday I took the medicine at 3 p.m., so I can write 2:30 p.m. today, because they just want to be nice in front of the doctor. So after 1 month, they have to complete the chart and they come back to the clinic to see the doctor. On the other hand, the other group who have to do the real-time monitoring, if they skip the medicine, and they were taking the readings, but the chart will be the real time, right? So for example, if they miss 1 or 2 days, it's okay, but because the dot point will show that how their compliance is regarding the chart, right? So they cannot say that whether they took medicine or, and their blood pressure was up and down, because the reading is real time from the device on the electronic record. So when the both group came back, and the doctor noticed that, the patients who were taking, the medicines and also recording through digitally from the devices, even though they missed the medication, but their graphs were showing more, compliant in the real-time readings compared to the one who were manually. And also they were putting the random readings on there based on the previous readings. So this is how it helped them to understand what is the patient's behavior, because sometimes they just want to be a little bit, more nicer in front of the doctor. And of course, the doctors, they can't monitor every time the patient's coming to them. Digital tools can empower patients to actively participate in their care. So, it's just a mutual benefit. It's not just for one side. So if the clinicians, they also want to see their patients improving, and also the patient wants to improve themselves as well, because that's their health issue. On the other hand, it also helps to increase the efficiency and cost saving. How cost saving it can be, it depends on the different services. So let's say, for example, I give an example of the readmission or revisit to the hospital. If the patients, they don't need to, have an extra, services, or they just need a consultation and opinion, they can get through that telemedicine, right? So they don't have to visit all the way back if the hospital is far, and also to wait for an appointment and to see a doctor and to pay the extra cost or fee for visiting and, spending all this cost. So this is one example, but there are many other examples which can help. And increase efficiency is also because, everything is recorded digitally, so which you can able to monitor back. So example, if you have a paper record and you have to bring to the clinic or hospital, and, you can't keep for the record for 5 years or 10 years, because papers are files you can't miss, or have, lost somewhere, or, might miss in the opportunity of the disaster or something like that happen. But having a digital record can help you to know what has been, done throughout your maybe particular disease, what are the procedures or the strategies you took, or the medications and all this kind of stuff, to understand and take the measures going forward. And it helped to improve your treatment plans as well. So digital health streamlines administrative tasks and reduces paperwork as well. So for example, every time if you have done, or any patient who have, maybe x-ray done maybe a few months ago, and then maybe, chest x-ray done for some certain disease for the chest, and maybe after 1 month have a complication again. It will help to understand doctors that, if you're taking too many radiology tests, it might help you to harm, it might harm you instead of just helping you. So if you have a previous test already in the system or record, so it will help the doctors to make a decision whether you need to have a more extra test or whether they can just see your previous x-ray, which is already in the record. But imagine if you don't have an x-ray or any report, then definitely they wanted to do some more assessment to make sure that you are not going to have disease. So this is how you can help to reduce more, unnecessary pathology or radiology tests as well. Data-driven decision-making is another example where we have a lot of information coming through the electronic health records. Well-structured information and a different perspective, and that all can be utilized well to make a data-driven decision-making. As I mentioned, that it will help to empower, because based on the previous history of the patients, the decision making can be done more precise. So it's more like in the precision medicine, where you can have the different specific treatment plans. And analytics also can provide insights for better treatment plans based on all this previous information. This is an example of the study we done on using the Taiwanese National Health Insurance Database. This study was done on the whole, the nationwide cohort population. And we wanted to see that the people who are taking specific drugs, which is called benzodiazepines, what are the risks for them to develop a cancer? And what kind of cancer? We usually, we take the drugs to heal ourselves, right? But sometimes some drugs, if they are trying to help you, to mitigate one disease, but they might have some carcinogenic effect to ending up, the patient with another disease. So we were interested to see that how, these particular drugs, because these drugs were more, people regularly were using, and we thought maybe, if this is not like, the chronic diseases, where people will become dependent. So it was interesting to see that the benzodiazepines, the people who are taking more than 2 months for at least 2 years, have a specific risk for cancers, and especially for the brain cancer. And then we try to dig further and see that, what about the other drugs? And interestingly, when we look into the aspirin use, and we found that the aspirin helped to reduce the colon cancer. So it's not like all the drugs have only the carcinogenic effect, but also some drugs could reduce the risk for certain cancers. For example, like aspirin help to reduce the colorectal cancer. So some drugs have the carcinogenic effect, but some drugs also have the mitogenic effect. So nowadays, we are developing a new drugs every day, but also we have to see that how we can able to, instead of reinventing the wheel, the current drugs already in the market can be utilized or repurposing of the drugs. And then we also did one study using the National Health Insurance Database, where we wanted to see, after there was a policy introduced in Taiwan, that there's sometimes antibiotics, if they are prescribed irrationally without having a proper diagnosis, it might lead to resistance in certain populations, right? So in Taiwan, they introduced a regulation that unless you have a confirmation from the lab result of the patient that this patient have this certain specific disease, you are not allowed to prescribe antibiotics. So you have to wait until, so for, let's say if the patient went to a clinic, so doctor have to first, prescribe the blood test or any result, and they have to wait for the result. They cannot prescribe the drug in the first visit. So they have to wait for the results. And then after waiting the results, if the test says there is some infection, then they have to prescribe according to that. What it did is it declined the antibiotics prescribing behavior in physicians. And that was interesting, because if they will be prescribing the medication, they got the penalty from the hospital. That why they got, because they were identified from the hospital was screened. So we wanted to see that what is actually the behavior. So it was interesting to see that, how it was declined in the antibiotic prescribing behavior, which was very, drastic change after the regulation introduced. So what I'm trying to tell you here is that all this was possible because there was an electronic health record. All the data was well captured, and all the data was captured by the healthcare professionals. So there was no clinical coders involved. So the doctors themselves will key in the information in the system. So you can rely on the quality of the information. So this is another study we introduced called benzodiazepine use in the breast cancer risk, of population-based study, gene expression profiling evidence. So this study says we try to introduce a new methodology where people, they were arguing that how we can able to say based on the observational health data. So then we try to come up with a strategy that, how, if we have the observational health data findings, and how we can able to compare with the gene expression profiling evidence and compare the results. And then it was interestingly that we able to find that the consistent results with our observational health data captured through electronic health records and also the publicly available genomic database online. And this is the study which I mentioned, the benzodiazepine-related hypnotic sedatives, got a media attention in Taiwan. And the reason it got media attention is also because the benzodiazepines drugs are mostly for anxiety and sedative. So a lot of people, go through anxiety, and they were taking these medications. And sometimes if they're taking for long term, then they got dependent on these medications. So when we did this study, and that this got a media attention, and because people were worried, a lot of people were taking this medication, and they were worried that whether they are having this kind of risk too. Though we try to explain that this is depend on the more research is required on that, but this is depend on the the findings we just identified on the observational data that this is a risk and were flagged. And also interestingly, our research, 2 papers were cited in the petition filed to FDA asking to revise the guidelines for these benzodiazepines. So the impact of our research was that much that one of the researchers from US has done a lot of research on these drugs. He filed a petition to FDA. The FDA approved the drugs actually, to ask to revise or to check the guidelines for prescribing these particular drugs. And this researcher cited over 2 studies as part of this petition as well. So there's a good acknowledgement of our work to at least understand that we are not the only one. There are some other research studies as well who identified this risk. So observational data is actually, nowadays people are also mapping with the international other codings as well. So you can do not just one national study. So there are different populations in, across the globe. So we have different consortiums. We are working on how we can able to collaborate and see that if we are trying to find out that one question answer from one study population, how it will be on the other study population. So observational medical outcomes partnership is, the develop of vocabulary based on the international standards where your data can be mapped to the international vocabulary. So you don't have to worry about sharing your raw data, you're only sharing the results. So for example, for the drugs is RxNorm, for conditions is SNOMED CT, for measurements it's LINAC, and for procedures, there's the ICD-9 codes and so on. We did international studies as well. So this is a study, application of common data model to rank the pediatric user prescriptions, prevalence of 15 different drugs classes in South Korea, Hong Kong, Taiwan, Japan, and Australia. And the reason is because we wanted to see what are the common drugs in pediatrics, what are prescribed in all these regions. All these regions are close to each other, but it will be interesting to see that what are the different trends. And we found that some are consistent, but some were totally different. And uncovering the exposure responsible for birth season disease effects, this is also a global study we participated from Taiwan as well, to see that this was an interesting study as well, because it shows the people born in specific months or specific season, what kind of the specific diseases risk they could have going forward in their lives. So for example, if someone is born in March, what kind of specific disease risk they could have or she could have. So this is an interesting study if you're interested to read it further. Then we also did the multinational cohort on analyzing the dual combination therapies used in the treatment of hypertension. We wanted to see that what are the treatment combinations used for hypertension in different countries as well. So this provides you opportunity to do the multinational studies as well. So what I'm saying is having these digital electronic health records, capturing this all information will help you to do the multinational studies and to see that what are the trends, where are the gaps. So this is another study, is multinational investigation of fracture risk with antidepressant used by class drug and indication. But having these opportunities, there are also barriers to adoption of digital solutions, right? What could be the barriers? And of course, first of all, when we talk about, nowadays, people are talking about ChatGPT, large language models, and other kind of, the advanced models or AI in healthcare. Of course, it's, everything, wherever you are going to adopt, you have to assess their benefits and also risk at the same time. You cannot ignore their risk at all. So if you are going to have a benefit for something, but at the same time, you also need to understand what are the risks, this particular, or is it safe to use, or it's not safe to use, or how much safe to use, or at what extent I'm going to use, or if it's really approved from the recognized authorities to use. So regulatory challenges are the one key thing. So compliance with complex healthcare regulations, for example, Health Insurance, Portability Accountability Act, HIPAA, or the General Data Protection Regulations as well. And then, of course, there are concerns about the data security as well, which could be a barrier to adoption, where there are not robust measures for the data security. And then resistance to change. Sometimes the healthcare staff, they don't want to adopt the new technology. They are afraid that, this technology might not be the helping, maybe it will consume more time. And this happens. Not all the digital technologies are very, user-friendly. So every time when they are going to choose a solution, you always have to keep in mind that you have to engage all the stakeholders on board, including the clinical and non-clinical. Digital health field is kind of multidisciplinary branch. So you can't totally rely only on technology or only on the clinical side. So you have to work in collaboration together. And of course, there's a resistance to change from the management side, from the staff. So how you are going to, mitigate or, to work out on this is also a thing which could be a barrier. So strategies for addressing resistance through education and engagement as well. So you need to find out some strategies, how you're going to address this resistance through education and engagement, because it is very important that you need to pre-plan. So you can't just bring any solution and put it in front of the clinician and saying that, oh, now you have to figure out to use it. You have to actually prepare beforehand, give them a training, let them know that how it's going to be beneficial, and then slowly and properly, make a plan to integrate and scale the project. So this is AI assurance framework developed here in New South Wales for AI strategy. Just giving you as an example. So you can see that this is a whole state AI strategy. It's not specific to healthcare, it's overall for anyone, any agency or any department is using. So first they have, you have to have the data model and organization governance as well, right? Then you need to have assurance framework, which has the public trust. You need to have the digital uplift, data capabilities, innovation and collaboration, and procurement as well. So for example, if you're, looking into the data perspective, so you have to understand, the data quality for analytics and machine learning. What are the standards on that, from ISO or other? What are the data visualization to assess the data quality, or AI data frameworks as well? And from the trustworthiness perspective, the assessments of the robustness of the neural networks, if you're using any advanced AI tools. So what are the trustworthiness? Is it approved? What are the requirements of this system? And the use cases or any specifications for that, and computational approaches as well. And from the governance side, of course, you also have to understand that what are the risk management in place from a safety perspective, and also the other ethical or social concerns as well. When we talk about the key strategies, so there are strategies for that which we can use to promote the adoption of digital health in different settings. So the first strategy, could be promote education and training. So you need to actually train or educate the people that what is exactly the digital health, and what could be the benefits, and what are the risks for that. Because not everything has the benefits I mentioned. You can't undermine the risk for those as well. So training for healthcare staff is one of the key. Continuous training and upskilling programs as well. Patient education on digital health benefits as well. And informed patients are more likely to embrace digital health tools as well. So for example, if you have one small hospital, and you're thinking to have a digital solution for that particular hospital, so you need to start engaging with the staff, and at the same time also the patients who are coming, and telling them the benefits, and also preparing some training programs for them. If you are getting a solution, any digital solution from the hospital or any settings, but you are not training your staff, then they will be struggling to use that system, right? So there's no point if you have a solution but they don't know how to use it, then you will struggle, and everything will be up down for that too. So, for example, when the COVID happened, people were trying to go online to search what is exactly the COVID-19. And this is the one study. You can see some of the authors who are involved from Indonesia as well. They're studying in Taiwan. So they did this study from our lab groups. It's the applications of Google search trends for risk communication in infectious disease management. And why? Because nowadays the patients, they have enough knowledge. Everyone is using technologies. Everybody has small smartphones and internet access. So what they did is they just, go to the online and try to search what is the COVID-19 and how they can able to help, to stay away or be safe. But it does not mean that everything available on internet is accurate. So you have to find information sometimes by yourself and to understand. So you need to have enough understanding that which information you can trust or which information you can't trust. But this is just telling you that, how many people search and what time they search. You can see here from the data that in January 2021, the search began, and it got more hype in February when there was a peak of COVID-19 where people were talking about, the surge of cases. And it was interesting to see that how was the people's behavior to search on this, about this particular epidemic. Then the social media also played an important role in healthcare overall. So for example, this study was done from our group that how the Facebook, helped them to make the healthcare reform in Taiwan. So when the clinicians, they were working in healthcare in the emergency department or in other settings, they sometimes have burnout because, the patient, sometimes people with the normal conditions, with just the common flu, they just go to the hospital, to the emergency. And at that time in Taiwan, because, there's a flu season sometimes comes and the patient just flood to the emergency department. And one of the reasons is because the outpatient clinics are closed on the weekends or in the evenings, late evenings, and though the people just want to feel like, they just go to ER and they get the services. So in that particular case, the complicated patient, the serious patients are also, actually supposed to be in the ER, but there are some other patients which are not on the higher priority also in the ER. So it becomes difficult for the clinicians to, how to separate and to provide the services. So there was a group, Facebook group, who started discussion among the healthcare professionals, the doctor and nurses, that, oh, it's very crowded. And then other ones saying that, oh, what we should do. Nobody will care about this discussing on the Facebook just because, this is just a social network. But then, as you can see that, there's one comment which translates that, is there any use of these posts? Does our minister have time to read the Facebook? And surprisingly, there was a response coming in, after a few minutes, that, oh yeah, the minister is actually, he looked into that and he visited that particular ER and he observed by himself that how crowded it was. And then he took an initiative to change the regulation to policy that, who should be visiting ER, with what condition, or maybe they have to pay an extra. So the purpose of showing to you this one is that the healthcare staff was just doing the discussion on the Facebook, but the health minister also looked into the conversation discussion. So it didn't go unnoticed. It was noticed and it helped them to change and to do the reform. So that's how they got attention, So sometimes, things are not always, as I mentioned that, you also have to look into the benefits, but at the same time, you also have to do the risk assessment. So social media is used for good as well. At the same time, it could be, used for the other sort of things as well. So I will give you an example. This is another study. For example, in this study, we look into that on the YouTube, there are so many, videos about how you can able to, reduce your weight. But how many videos are really, from the clinical perspective, are reliable in providing content? So the researchers from a lab, they did some study and they found out that overall the content, they selected top, the viewed videos and top rated videos. And they asked the healthcare professional, the doctors, to classify and see that, how much content is really healthy content. And they found out that, more than 50% of content was not really the correct one. So means the healthcare professionals found that this is not, really relevant content and it's misleading people's health. This is how we have to regulate the social media and all these things, and also at the same time to educate the people as well, because not all the information on the social media or online are all the time accurate. And then there was an infodemic. Infodemic term was introduced by WHO during the COVID time, where you can find a lot of information online. It's an overabundance of information, which is online or offline. And sometimes it's mis or disinformation, and it can be harmful to people for physical or mental health. And, it can increase stigmatization or threaten the, precious health gains. So, people were, when there's all kind of information on social media, so it depends on the literacy, how you can able to access which is information is really useful, correct, or which information you should be relying on, or which information is harmful or not really good. So for example, like these were the informations where people posted that, these things can help you to stay away from COVID, but not necessarily clinically approved, right? So for example, like ginger tea can help to treat COVID within 3 days, and all kind of this information over there, like turmeric and lemon, help to fight and stuff. And this information spreads so fast on social media that if someone will share, then the other network friends or other people will share automatically too. Sometimes people just share the information even without reading, they just send to 50 or forward to 50 or 100 people together. So you can imagine that the social media information spread so fast compared to the normal, the media. And WhatsApp, Facebook, all these social channels. And then there were some initiatives taken by the WHO to ask those social media industry to revise and to look into their regulations, that not allowing people to just, share the information with a huge number of groups. So at that time, the WhatsApp limit to forward the message to certain people from, I think, more than 50 to just 10, or this happened because the misinformation was spreading so fast. And same thing happened that the Facebook was taking down the content which was not correct too. And because WHO wants to take an action to, keep people, audience, stay away from the misinformation, so they intervene and engage those social media industry partners. But there is also purposes for social media in the education. There's a lot too, So as I mentioned, that there is a good of social media where, if you want to educate people, you can use that. But at the same time, you also have a content where sometimes you have to double check and assess whether you should be trust on the information or not. So this is an example where, the people working in the healthcare settings, and especially in COVID, where they have to wear the mask for a long time and they were having the long shifts. And sometimes, if you're wearing your mask for a long time, you feel like, pain or, behind your ears and stuff. So I found that this video was interesting and giving a good message within a short time. So for example, this video is telling this person that if your mask is causing irritation behind your ears, so what you should be doing. So let's watch this for a few seconds.
They call me Taco. I don't know who's Margo. I just make this lotto.
So as you can see that in this video, they try to show that instead of having this the mask behind your ears, you can put it behind the the hairs to tie in that specific way. So this is just one example that to help people to educate just in a short way. And then WHO also made the group to educate people, and on the WhatsApp as well, introduce that what are the information which you can rely on from WHO. So the key strategies also include engaged leadership. So strategy 2 is importance of leadership to buy in and support for digital health initiatives and the role of champions within organization. And I like this, the 8 questions from Dr. Eric Topol in his book. Some people ask him the questions that, what is the AI medicine, look like future, and whether it's going to replace human. Most of people worry, that you need to change the leadership behavior. The leadership have to understand the future trends and to understand that what are the solutions which are going to help to improve the care and their efficiency. So in some settings, the leadership behavior really requires a lot of work, where you need to be a champion to take a step forward, to willing to take a risk, but at the same time not undermining the challenges, and to educate or to bring motivation among your healthcare staff. And if the question comes back to the clinical settings, whether it's going to replace the humans, so Dr. Eric Topol mentioned that the AI always need human, so it's not going to replace. That's a misconception. But for the very basic administrative tasks, definitely it will help to replace, and that's the main purpose for AI, to help to improve the task. So for example, like administrative tasks where you have to make an appointment, have an automatic questions, responses back, these kind of things. Strategy 3 is about the interoperability and enhancement. So ensuring that different systems can communicate role of standardization, data formats and APIs, and facilitating the seamless data exchange. Examples of how the interoperability can improve patient care coordination, and importance of partnership with electronic health record vendors or the health information exchanges. This is very interesting because healthcare system is very, very complex. There are different departments, all the different departments across, they sometimes have to, share the information to communicate with each other. How we can able to exchange the information in a safe way, in an efficient way is very important. So electronic health record vendors plays important role because they are the one who, are providing these tools and services, and health information exchange is very important as well. So the interoperability is one of the key where you have to, involve the different stakeholders and to work on the safety and security, and what are the different standards, international standards, which you can work on. This is one example, is the 3 key aspects of the interoperability: technology, the relation. So you can see here there's a role of culture and leadership as well in joining the care. So interoperability is more than a technology. It's not just about the technology. So for example, if you have a solution, what you will do is the same thing if someone has a smartphone, but they don't know how to use the smartphone. So imagine if you are giving someone, a person who never used any smart device before, but they are actually using first time. And if they don't know how to use it, right? If they don't know how to use it, then they will be struggling with the, the solution, how to use it. Or maybe if someone is a, older person and you're giving them a smartphone, but they don't want to use it because they are used to the normal phone. So they feel like it's a very complicated to use, right? So it's the same thing. It's not about just technology. So if you are giving someone just a technology, but you're not actually giving them, the motivation or telling them the importance, is, how it's going to be beneficial, that it will be difficult. So that's why it's not just about technology, it's about the relationships as well. So having all these things into consideration, relationships with technology, with the information governance, training and skills, workflow, workforce capacity, national policy and targets, and funding, of course, as well, to make all these things happen. Strategy 4 is data security and privacy, which is very important because a lot of discussions going on nowadays about the data security and privacy as well. So sorry, I was just checking a chat that if there's any questions so far. So the data security and privacy, robust security measures need to be taken. Encryption, access control, and audit trials is required. Compliance with healthcare data regulations is important. Steps to ensure the adherence to the data protection laws. And importance of regular security audits and the risk assessments is very important. So because there are, the opportunities, but there are also challenges that I mentioned, right? So with every opportunity, there's challenge comes as well. So you can't undermine that. So of course there are cyber attacks where, you have to make a proper robust measures to make your data secure, right? So you need to make sure you have a good infrastructure, your policies and procedures are in place to protect the laws, right? And also the regular security checks as well required for the privacy and security. I just want to pause for a while here and want to ask if anyone has any questions so far.
Okay, so for all participants, if you have any question, you can raise your hand or maybe type your question in the chat box. Any question for the participant? Okay.
Yeah, feel free to ask if you have any question. If you don't, I will just continue and we can have a discussion at the end. So I just want to ask if you have so far any question at this moment. I'm happy to take that.
Okay, so if there is no question for the participant, maybe I want to ask you about, you have mentioned about the barrier, all of the barrier that you have mentioned before. So among all of the barriers that exist, which one do you believe that is the most commonly encountered, and how can it to be overcome based on your experience in Taiwan, Australia, or Tasmania?
It's a very good question. Actually, different settings has different kind of barriers, right? Because it depends on the main strategy from the government or from the people, what they want to achieve, right? So for example, Taiwan have the clear direction that they want to have the technology overall to improve the healthcare, right? So there's a clear motive in that. So, and they had the funding for that particular as well, right? So in that space, then they have a challenge, could be, like what kind of the solutions, how we can improve more solutions and how we can find the more best solutions which can be fit well. But on the other hand, in some places where they don't have the funding, but they want to do some solutions, right? So you want to integrate some solutions in healthcare too. So there could be a challenge of the technology funding as well, because this is not cheap. So when you are going to have an infrastructure, you have to assess the benefits in the long way, that how it's going to be helpful in the long run. Because sometimes it looks like it's a huge investment, but in the long run, how it's going to be helpful is very important too. But in some cases, we have seen that the people, they're trying to have the solutions, but they failed because they did not choose the right solutions for the right, problem. So for the particular problem, you need to also choose the right solution. That is also another, I think, the challenge. So it depends on the clear direction. So sometimes, mostly I found that the people have the funding issue because it's a huge investment where the government have to take initiatives and to come forward and saying that, this is here the incentive for you if you are using the technology into your settings, because it's going to be a help to improve. But in some settings, there's a challenge of where people have the lack of motivation to adopt the technology. So where you need to have more leadership focus, which can encourage people to adopt the technologies. So it's a kind of depend on the different regions' appetite, where you are putting a little bit investments at the same time. I was involved in one of the projects where I came to understand in Taiwan that the primary healthcare providers were given incentives that they should be using the digital record in their clinics. And the reason is because the hospitals were already having the electronic health record. So hospitals have the money, right? But the small clinics, GPs, they don't have the money, right? So they have to pay from their pocket. But sometimes they don't have enough money. So the government supported them at some extent and saying that, okay, if you use this solution, so means that the data will be electronically driven, right? So then the manual thing will be reduced. In the long run, it will be helpful for both, right? But they step forward and they help to, the local general practitioners. On the other hand, the way of working is different as well in Taiwan and in other settings. So for example, in Taiwan, you can go to see any specialist in the hospital. You don't necessarily have to go to see a GP, right? But in Australia, you must have to go to a GP first. And if you don't have the referral, you cannot go to see a specialist. And sometimes you have to wait for longer to see a specialist. So this is also a way, a kind of different that how we can able to, work out and see that the things can be improved. I hope I answered your question. Is
Yeah.
there any other question, or I should?
Okay, ya. Jadi as I want to translate your answer to the audience. Oke. Ya, jadi Bapak Ibu tadi saya menanyakan terkait dengan barrier apa sih yang sebenarnya sering ditemukan di banyak negara ya, dari pengalaman Dr. Rusman ini di Taiwan, di Australia ataupun di Tasmania gitu ya. Ternyata barriernya memang berbeda-beda ya. Ada yang misalnya di Taiwan itu ya ada barrier yang terkait dengan teknologi, karena memang teknologi kan butuh dana yang besar untuk pembangunan teknologinya. Kemudian beliau juga menyampaikan tadi, kemudian di Taiwan ada kebijakan untuk memberi insentif bagi klinik atau GP ya, dokter praktek swasta untuk menerapkan EHR-nya di sana. Jadi EHR-nya sudah sampai di primary tapi sampai dengan klinik-klinik swasta begitu. Jadi ada insentifnya seperti itu. Jadi kalau di rumah sakit kan memang dia punya duit ya, jadi bisa buat EHR, tapi beberapa klinik yang kecil mungkin tidak punya, jadi ada insentifnya. Kemudian juga terkait dengan bagaimana mekanisme untuk menemui beberapa dokter, misalnya di Taiwan bisa langsung masuk ke dokter yang spesialis ya, sementara di beberapa negara, di Australia misalnya harus ke GP dulu, di Indonesia sepertinya juga begitu. Jadi memang ada beberapa barrier yang, jadi memang barrier-nya ini tidak selalu mulus ya, pasti ada barrier-nya. Okay. Then any other question from the audience? Di kelas ini ada mau tanya? Okay. So
I saw one online question from Isma. How to improve health data security in the digital era, because currently there are many digital leaks. It's a very good question again. So what happens usually is that you take into account that whenever you're, building a database or buying any solution, that what are the protective measures they have. So you have to have the protective measures that who can able to access. You need to authorize the different level of, the access to the people. So it's not like everyone can just access anything. So for example, the specific person will give permission to specific thing, and who can able to share the data if need to. With whom permission, and what are the environment which you are keeping the data. Are you keeping, because whenever you have a vendor or any solution, you ask them first whether they are going to host. So for example, let's say if you are having in your solution in a hospital in Semarang City, you will ask them that whether your data of the patient will be staying in Semarang, or whether if the company is from UK, the data is going back to UK. So it's very important when you're doing these kind of things. So if the company say, oh, we actually were planning to send data to the UK because our company is there and everything is controlled there, but because as a customer, you can ask them, this is our solution, this is our hospital, this is our data. So we don't want any data going out of the country or out of the state, right? This is how you work out on the plan. And then more and more other procedures and, steps on that too. So sometimes if we are not aware of that, so what we do is we make an agreement, and then companies host data in the different regions. And then, you will not have a control. And if a company does not have the very robust measure, then there is a chances, for a risk as well. So this is, I hope I answered this. So I will pull the slides again and continue, and then we can stop by. Please feel free to ask any question if you have. So the key question. So key strategies also include the patient-centric approach. So patient-centric approach is, the empowering patients with digital tools. So for example, patient portals, telehealth apps, wearable devices, personalized care plans, data-driven insights enable tailored treatment plans, or role of shared decision-making and patient preferences. So as I mentioned already, a lot of patients using mobile applications, they are wearing the watches, smart watches, which can help to monitor their own information. And also there are some other patient portals or, some telehealth apps as well, which can help them to navigate their own information. And nowadays, if you're wearing a wearable device, so you can monitor your, how much you walked, you did exercise, what was your heart rate, your respiratory rate, what was your calories, how much you slept, what was your sleep quality. All these things can be monitored easily. Digital interventions for healthcare improvement. This is a study we done, one of my master's student done, on the impact of the digital, interventions for diabetes, mellitus. And what we did in this study is we tried to check the applications for interventions and medication adherence in type 2 diabetes mellitus. So we did a systematic review and meta-analysis to see that how these digital interventions help on the medication adherence for type 2 diabetes patients. This is another study. Also, we did systematic review and meta-analysis on digital interventions for self-management education for type 1 and type 2 diabetes. Because the diabetes is a chronic disease, but it's a long-term disease. So the patients, they have to do the self-management. Not every time the doctor can, check them whether they are taking medication or not. So they have to use it. Sometimes, there are digital interventions which they can use. So this is how we find out that, what are the interventions were useful. You can have the full paper to read through. Strategy 6 is about the continuous improvement. So anything you have, you always need to continuously monitor and to see what are the chances for improvement, right? So importance of ongoing evaluation and feedback loops, quality improvement methodologies you can use like Lean or Six Sigma for the optimizing digital process, or encouraging the use of data analytics for performing the monitoring. There are success stories. I will share some of them with you that, where these strategies led to increase the digital health adoption. And specific outcomes such as improved patient satisfaction or reduced costs or better clinical outcomes. And examples from healthcare facilities, for example, like in Taiwan. The Taiwan healthcare infrastructure, and why I give example of Taiwan is because I worked there more than a decade. And the Taiwan health IT infrastructure looked like this. So in this figure, you can see here that there's an insured population of 23 million. The 23 million population is a whole country population. And they have the single payer system. And then they also, if they are going to hospital, they pay a little co-payment. So for example, anyone who visits any hospital, the hospital will provide them services and they pay a little money. And then the hospital will send the data to the National Health Insurance, the single payer system, to the government. And they will get the payment from the hospital will get the payment from the government as well, because you're under insurance, right? Because you're paying every month too, premium. And then because you're paying the premium to the government, and the government will give you the National Health Insurance IC card. So whenever you go to, you are allowed to choose any public or private hospital. There is no issue that why, you can only choose one. So it depends on your interest. You can go to directly to see any specialist I have mentioned. There is a no gatekeeper mechanism like you must have to go to GP first. So if you feel like you want to go to GP, it's fine. If you want to go to see a specialist, you can go. Then all the data is also available in My Health Bank. So My Health Bank is an online platform, or you can either, have your mobile app in your phone. So you can able to access your all information in your app. Means you are a patient, right? You're a consumer. So you have a right to access your information. Why not, right? And that data from the National Insurance, the cohort, the de-identified, also released for researchers to do a research. And the reason is because they want to have this, to improve the outcome, so that they want to release some information for, the researchers to improve, work on the healthcare improvement. And Taiwan have done a lot in artificial intelligence. Why? Because Taiwan has a strong information communication technology and academia collaboration. Is one of the most high performance healthcare system also in the world. Very high outpatient visit number as well. So there's average person doing 15 visits per year per person. So you can imagine that how many visits. And every time they visit the hospital, the physicians will key in the information by themselves in the system. So there's no coders involved. And there's an accurate e-prescription. And why they capture accurate? Because they want to claim from the National Health Insurance, right? The hospital. So the data quality is very clear. And if the prescription, if any information is missing from the prescription, let's say if the prescription has only the drugs names, but there's no disease code, then you don't know for what purpose you are prescribing this drug, right? So the NHI will randomly check the sample, and if they found that some number of prescriptions are not correct, they will send a plenty or they will not reimburse to the hospital, right? So that's why hospital have to control the quality of the data as well. 23 million population overall Taiwan, and for 23 years of the electronic health record. So you can imagine that you can monitor one person back to 23 years. So if someone is just 22 years old, you can see the whole history of that person throughout. A very standard coding and data scheme. So during COVID-19, Taiwan took advantage of big data analytics, new technology, and proactive testing. How they control their COVID-19 pandemic is that they utilize the healthcare, big data, opportunity, the advanced technologies as well, and also they were doing testing. And they link the immigration data to the hospital data. So let's say if anyone visited from country A coming back to Taiwan, right? And after maybe a few days, they are feeling sick and they are visiting any hospital. When they are visiting a hospital, they might not want to disclose where they were traveling, right? So there could be a risk for a doctor or nurse, whoever looking into that, because maybe the patient say, oh, I didn't travel, but they might carry, the COVID virus. So the doctor can able to access the patient information, including their immigration information that where they traveled in the last few weeks. So it was interesting to find some cases where the patient, when they visited to the hospital, they say, oh, they did not travel anywhere, but it happened that they traveled and they were having the COVID positive. And the doctor, they identified from the database, and then they isolate them from the beginning, because otherwise it could lead to the healthcare risk as well. So this is how, it helped the connection of the data to help them to improve. But that was only to access in a public health threat perspective nationwide. Then there was a My Health Bank in Taiwan. That's how it looks like. So all the patients, they can able to access their information. So you can see there, you can see your personal health information for example, like CKD disease, or for dental history, or for other information. How this was useful during the COVID? Because patient can access their own information, and this is based on the algorithms to help to give personalized information. During COVID, there was a resource allocation challenge, right? Where people, they were struggling to find the mask, and some resources were not controlled well. People were misusing, and somewhere you need the resources. So Taiwan introduced eMask through My Health Bank, where people have the mobile application in their phone or online through My Health Bank, and they can able to purchase the mask, but they only allowed to choose purchase 3 masks per week, because they were insured and they have the number and they have to use a National Health Insurance card. So they cannot allow to purchase more than 3 masks per week. And they thought that 3 masks are enough for a person, because they want to control the resources to have everybody, the mask easily accessible. The second thing what they do is that you don't have to go in the queue in front of the pharmacy and wait there for this. You can just purchase online, pay online, or you can just buy online and find a nearby pharmacy to your home, and then you can go and pick up anytime within the timings. So you don't have to go and wait in the queue. That also have to reduce having the the virus when you are in a queue. And also it helps to save their time, right? And also to monitor the resources. What are the challenges and solutions? So the common challenges we discussed here is that that there's a budget constraints, right? There's a budget constraints, and then you have the staff to buy in, and then there's a technology compatibility as well. So present solutions and the best practices to overcome these challenges, including the change management strategies as well, is very important. And you need to have an importance of dedicated digital health team or committee as well. So having all these things in mind, that funding is of course a big constraint, as Dian asked before, because the technologies it's like a kind of infrastructure, so you have to invest, but it's like a long-term investment. So budget constraints for most of the the regions or the government or the different healthcare settings, and then the well-advanced trainings required for staff to use those systems, because you can't just buy the solution, you also have to give the training. And the compatibility, if you're buying one solution, it's necessary that the other solution should be compatible. Otherwise, everyone will be working on a separate things. So it's very important to work how these technologies can talk to each other. So what are the future trends? The future emerging trends in the digital health is, for example, like AI-driven diagnostic and decision support things, remote monitoring for chronic diseases, telemedicine expansion, including, the telehealth services, blockchain in the data security, potential for virtual reality or augmented reality in healthcare. These all are things which are in the future trends, right? People are using VR to help for rehabilitation. So for example, if someone need to do some physiotherapy, they can use a VR to do those kind of, the exercises. And that help them to do, the regular things. For the data security, the blockchain, how it can help. For remote monitoring, for aging care, you can use, the wearable devices or the sensor technology. So there are the future trends, which are already, some of them are adopted already and some are still under research. This is a study we did on AI for earlier medicine. AI for primary prevention, and we also discussed that how AI is for secondary prevention and AI for tertiary prevention. So we try to have this position paper which says that chronic care, how it can help for the preventive care perspective, from the acute care perspective, and from the chronic care perspective. So there should be actionable, accurate, timely, and individualized as well. So if you're interested, you can read more in detail this paper, that how can AI make medicine more preemptive. So future care models. As I mentioned that the technology is evolving day by day. This is a book chapter. We have done a project in Taiwan where we use infrared camera to monitor the patient condition for the ulcers. In the aging care, where patients which are already very vulnerable population, you need a lot of resources, right? So sometimes if there's a patient very elderly, cannot change by themselves, you don't have enough people to take care of them. So you need technology to help you, right? So if you don't have enough nurses to change their position, sometimes you struggle because if you don't change their position, they might get worse, right? So bed sores or ulcers will get more worse. So what we did is we had the infrared cameras and we developed an AI algorithm. So what helped is the infrared camera will not take their face or other identification. It will only flag the ulcer area, and the camera will automatically turn the different lights and also give an indication and the alert to the nurse when there's a time to change their position after a certain time. So it means nurse don't have to check every time, only will need to check when there's an alert for her. This is another short piece we have done editorial on healthcare artificial intelligence. The road to hell is paved with good intentions. It means that when we talk about AI, it's not like every time we say, oh, AI is going to help and solve everything. We also have to be very careful when we are developing the AI solutions. For example, if you are developing AI solution on specific population, let's say maybe on the US database, that's not necessarily that it's going to work on the Indonesian population as well, or maybe Australian population, right? So you have to keep in mind all the data bias, races, and that how the ethnicity or the different genetics is going to have an impact on that specific models, AI models. These are the book chapters. If you're interested on a little bit more that how the Taiwan has a health information technology journey, Taiwan started from flash drive with USB to health cloud now. You are most welcome to read this book chapter in the book. And this book is published in the health system improvement across the globe, success stories from 60 countries. And then there's another book chapter, which is on My Data, My Decision. Means if you are a consumer patient, it's your decision. So Taiwan health improvement journey from big data to open data, where they wanted to have an open data for the population. So currently we can see that, there's a scenario where people are, if they are riding bicycles, they have the trackers, the wearable devices. If people are using some specific, kind of tools, they can also, you can monitor their vitals or mobile applications or the, the medication history and stuff. But the future could be, you can have a smart homes where you can have the sensors around you, or in the shopping center sensors, or, all the information will be collected, or when you're traveling, or smart cities, people are already talking about all the information will be collected and going to help you to improve your healthcare. So this is, already published in 2016. Thought maybe it will be helpful to understand how it's going to be helpful. So with the conclusion is that we need to emphasize the importance of embracing the digital health for improving the healthcare delivery. We also need to encourage healthcare facilities to take proactive steps towards digital transformation. We also need to express the optimism, but not undermining the challenges we have with these advanced technologies about the future of digital health and its potential to revolutionize the healthcare. But keeping in mind that what are the safety and security measures? Are these AI solutions are safe? Are these digital technologies are safe to improve the care is also very important. Thank you all. So I'm open for discussion now. There are some useful resources as well if you're interested to read some more about this. So I'm happy to take the questions now. I'm going to the chat and see if there's any question.
Yeah.
Yes,
Okay,
Dan.
Okay, so we have one question here from Eko Prihartia.
Okay, yeah. So what strategy should be implemented to ensure that the doctor in charge of the patient is fully compliant and disciplined in the implementation of EHR in the hospital inpatient service? What are the potential consequences for the hospital service processes if the doctor in charge of the patient is not fully optimized in the implementation of EHRs? It's a very good question. So it's not only the doctor is responsible, actually, the management is also responsible. So the one who are the main leadership team, when you are implementing any digital solution, you always have to engage the the different stakeholders. That different stakeholders includes your healthcare administration, healthcare management leadership, your clinicians from doctors, nurses, pharmacists. Also, you need to include your consumers, the patients. And also you need to include from the business perspective, the operational people, that how they are going to support the systems, right? Because you need some IT team as well. You can't rely totally on the vendors. So you need to see that what if worst case scenario, if the system is down, what are the alternate for that? So how the third party, because for example, if you bought a solution and the company is in other country and the other country time is different, maybe they are not working at that time, right? So what is your agreement with that company that if your system is down, whether they have people in your country as well, whether they have a sub office in your country, whether they have any technical team in your country as well to support that solution, then you have to keep all these kind of things in mind when you are having those kind of solutions, right? Clinicians are more like a users, right? Because they are the users of the system. They did not design the system. So they are more like they are more users who keen the information, to access the information, to help to make the decisions for the patients, right? That's the important thing. So while having everyone to participate is very important. So healthcare leadership, management, clinicians, whoever responsible to work together in the digital health space. As I always mentioned, the digital health is not just one domain. So it's like a multidisciplinary. So for example, you need to have a people from public health, from healthcare management, from the clinical group, from the non-clinical group, and then work together. There's another question from Professor Chatri is that in my experience, how to support the manager in health facility change their culture in using digital healthcare? It's a very good question again. I think the managers need to have motivation, enthusiasm to use the digital technologies and to have an understanding that how that digital solutions can help to improve patient care, but at the same time, how it will be efficient and to help to save the cost as well. So if we understand all these things as a health manager perspective, what are the challenges? And also we need to work on the training of our workforce, that, to equip them with the new skills, that what are the things they need to learn, what are the basic understandings they need to have, right? So simple example is like ChatGPT. People are talking about that, but if they don't know what are the consequences of that by sharing your safety or the secure information, then they might be using without that, right? So it's the management responsibility to share with their workforce that what are the key things they need to keep into account. So yeah, feel free to ask any questions. And I also left my email. Please feel free to also shoot me an email if you have any questions. I'm happy as well afterwards too. I also encourage, if anyone is working on any digital health related papers, we have several journals, but one of the journals, CMPB Update Journal, is on open access, but we can commission a good paper if we feel like, oh, this is potential paper. And we can fast process that too. If any of you is interested, we welcome that.
Yeah. Okay. So maybe for all of the participants, I just want to resume the material from Dr. Usman that sorry, wait. So he so the speaker highlighted strategies to boost digital health in healthcare. So this includes its benefits, solutions for adoption challenges, and success stories. So digital health comprised of EHRs, telemedicine, wearables devices, IoT, and also AI. It improves outcomes, engagement, efficiency, and data-driven decisions. And overcoming regulatory and security challenges is vital. And future trends involve AI diagnostics and remote monitoring. And also the main takeaway, embrace digital health to enhance healthcare delivery and proactively pursue digital transformation for an optimistic healthcare revolution. So, jadi Bapak Ibu ya, pembicara itu telah menyampaikan materi ya terkait dengan strategi untuk meningkatkan ya penggunaan digital health di healthcare. Nah, tadi ada dijelaskan tentang manfaatnya, kemudian dijelaskan juga terkait dengan barrier-nya apa saja, kemudian ya challenges-nya apa saja, kemudian sukses story-nya bagaimana tadi juga sudah dijelaskan ya. Kemudian saya boleh review sedikit tadi beberapa manfaatnya, misalnya terkait dengan peningkatan hasil pada pasien. Jadi pasien dapat jadi pelayanan itu bisa fokus kepada pasien ya daripada proses administrasi dan sebagainya. Kemudian juga ada standarisasi dari kode-kode ya, dari sistem pengkodean standar, ada SNOMED untuk kondisi tadi, LOIN untuk pengukuran, ICD-9 plus untuk prosedur dan sebagainya. Kemudian juga tadi ada hambatannya dari regulasi, masalah keamanan data ya, data security, kemudian juga bagaimana strategi untuk mengatasi resistensi melalui pendidikan dan keterlibatan. Kemudian tadi ada strategi yang diberikan. Strategi pertama adalah promote pendidikan dan pelatihan. Kemudian yang kedua strateginya adalah melibatkan leadership ya, kepemimpinan. Dan juga tadi yang ketiga ada peningkatan interoperability ya dari dengan menggunakan API yang standar ya. Dan ini juga sudah diterapkan juga di Indonesia tentunya. Nanti Bapak Ibu bisa tanyakan juga ya bagaimana misalnya kondisi Indonesia dan sebagainya. Kemudian strategi keempat ada keamanan dan privasi data. Bagaimana kita harus menguatkan ya terkait dengan keamanan dan data privacy. Kemudian yang kelima strateginya adalah pendekatan yang berpusat pada pasien. Oke, dan keenam juga ada perbaikan berkelanjutan ya dari sistem yang ada. Kemudian tadi ada beberapa cerita suksesnya bagaimana infrastruktur di Taiwan yang menggunakan aplikasi namanya My Health Bank ya, dan juga sudah menggunakan AI dalam analisis data kesehatannya. Oke, kemudian ada tantangan dan solusinya, ada keterbatasan anggaran, dukungan staf, kemudian kompatibilitas teknologi dan sebagainya. Kemudian tren masa depan nantinya akan ada diagnosis dan dukungan keputusan berbasis AI. Tapi tadi disampaikan bahwa kita harus berhati-hati dalam penggunaan AI karena bisa jadi penggunaan pada ras yang berbeda bisa menghasilkan hal yang berbeda pula. Kemudian ada skenarionya masa depannya bagaimana terhubung ya antara IoT, smart home, kemudian smart city dan sebagainya ya dalam satu sistem. Dan kesimpulannya bahwa menekankan pentingnya untuk merangkul kesehatan digital untuk meningkatkan pemberian layanan kesehatan, kemudian mendorong fasilitas layanan kesehatan untuk mengambil langkah proaktif menuju transformasi digital dan juga mengekspresikan optimisme terhadap masa depan kesehatan digital dan potensinya untuk merevolusi layanan kesehatan. Okay, so for all of the audience, if you have any other question, ada pertanyaan yang lain dipersilahkan, Bapak Ibu. Yang di kelas, silahkan ada yang bertanya? Bahasa Indonesia tidak apa-apa, silakan. Mau di sini? Ya, oke. Iya, nggak apa-apa. Oke. Baik. Oh iya, oke.
Istighfar saja Pak, perkenalkan nama saya Sofi, mahasiswa FKM 2023. Di Indonesia ini ada program platform dari pemerintah yang bernama Satu Sehat.
Oke.
Di mana target dari pemerintah itu satu platform untuk semua kebutuhan, baik dari pemerintah, dari pasien, termasuk pemberi layanan kesehatannya. Nah, dari pengalaman Bapak, apakah ada negara yang berhasil melakukan hal tersebut? Bila berhasil, seperti apa implementasinya di negara tersebut? Terima kasih.
Okay, now it's
Sophie.
Sophie. Okay, so there's a question from Sophie, master student in public health. So she asked that in Indonesia we develop application. The name is Satu Sehat, One Health, One Health application. So it consists maybe like My Health data bank, I guess, like in Taiwan. So the question is there any country that implement that program like the application? And also, what is the okay, so how about the implementation, and is there any success story for that kind of implementation?
Yeah, that's a very good question again. I think this is going to be future where you have to have your own data or information in your hand. When I say in my hand, it means the mobile you carry, right? Let's say if you're traveling some country and something happened, so you can't carry all the record because you can't tell our doctor everything, right? So if your mobile or My Health Bank kind of app is in your mobile, you can able to have your information or history, which you can able to share with the doctor. So yes, Australia has called My Health Record, which is similar to My Health Bank, but Australia still in a process of implementation, not yet successfully did the complete, and there are several reasons for that. One of the reason is the pushback from the population, where they say they don't want to share their information on the platform and the application. However, and also, so there's no comprehensive information yet. So for example, if you want to access your information, even though you want to, have you opted out for that, but it's still challenges, so you can't. Compared to Taiwan, where I have My Health Bank in my mobile, and I can able to access all the information, but not just accessing my information, as I give you example of eMask and other. Also, I can use this to do different things. For example, personalize my healthcare. So if I feel like, or the patient have some specific diseases, based on their history, the system will automatically make a plan for them. Let's say if someone is with the diabetes, they will tell that, you need to do exercise, or you need to, do this or proper, all these kind of things. So the healthcare should be more personalized and precise, not general, because not everything works for everyone, right? So for example, in a class, there are, if 100 students, not everybody will like to learn in the same way. Maybe some people like to study with the group, some people like to study by themselves alone. So healthcare also, the different genetics, different bodies of people, they have the different way of having the behavior to adopt to the healthcare. Having this individual information collected in a proper way through these apps should not be just to collect the information, but also help to empower you. So means to individualize your healthcare plans, to improve your healthcare, but not also just to rely on the medication. So we should not wait to get sick and then say, let's go to the hospital and take medication. What we should be doing is more preventive care. Means before even somebody's going to have any disease, they should be automatic before they should be, because the body changes before, right? So let's say if somebody is going to have an infection, before infection, there's a common symptom. What is that symptom? Is fever, right? Every infection, before there is a fever. So if the body temperature changes, it means there is something going to happen wrong with the body. The same thing, if we keep ourselves healthy beforehand, then we don't worry much, then we don't have to be dependent on the medications too. So that's why we want to encourage people to have a healthy behavior. So where it comes to public health, because this is the main thing where we need to take charge here. We need to be active here. We need to tell people that, you know, this is from the global health perspective. This is from the public health perspective. This is where public health informatics comes, that, you know, you don't necessarily have to wait to get sick. You need to take care of your health beforehand. So change your healthy lifestyle, healthy diet, do exercises. If you feel like, you know, this is, you need to do that. And if someone has one disease, and if they don't work out on that, they're more ending up getting another disease. So let's say if someone has the diabetes, there's a comorbid disease, which is hyperlipidemia. And if someone has a hyperlipidemia, in few years, they are going to get diabetes. It's just because they are just interconnected. So, but if they change their exercises or lifestyle behavior, like doing proper exercises every day, controlling their diet, it will help them to stay away from the other disease, you know, so preventive measures, or sometimes people take the preventive drugs as well. So I think public health has a very big, huge role in the digital health space, in the preventive care. So we need to be active, staying away from disease, and educate people and saying that you need to do this. You know, if you change your lifestyle, you might be. And if someone has a family history of diabetes or hypertension, so we can educate their next generation saying that, you know, this is a history. If you change, if you keep your lifestyle in that way, you will stay away from that disease. So you don't necessarily, you know, getting that, and then dependent on the medication. Because once someone is getting dependent on the medication, then it will be a huge cost burden, not just on the healthcare system, but on the person as well, right? And then they start taking medication, then they're ending up having the other issues as well, because the medications are not just like a, you know, something very, how to say, is like, you know, comfy thing, because when you are taking those chemicals, it also, you know, excrete from your body and can destroy other organs as well, like liver or, you know, the kidneys. That's why we adjust the doses of the medications for the patient based on their conditions. So it's better not to be dependent on that, not going towards that. So I think public health has a huge role in the digital health space, which I say that, you know, we have to be active. We have to tell people, you know, you have to take these initiatives. So digital interventions like mobile applications and this My Health Bank, and I think the application you just mentioned from Indonesia is one of the key, where we can start having the health literacy for people and telling them, okay, use this application, monitor your healthcare every day where you're doing exercises and stuff, and how you are feeling yourself, right? What is your mental stress? What is your health? What is your exercise? And, you know, how many steps you have done to help to shape and to control your health. So, and that will give you a sense of your participation, because it's your health, right? You cannot just expect that the doctor is going to solve everything. So your interest as a consumer should be as much as you expect from the doctor too. That is just an advice, right? But they can't see you taking medication or monitoring. So I think that's the role I see from the global health or public health perspective that we need to work on. And the digital health has a lot of opportunities for the public health people, because we are coming from the where we understand the behavior of the people. We can able to, you know, tell people the health literacy. We can educate them about the digital interventions. We don't necessarily have to know what is this tool develop, you know, like how it was developed or something. We need to know how we can use it, right? It's the same thing when you are buying any device. You don't need to know how it was made, you know, you need to know how it's useful for you to use it to help you to improve care. So same thing in the digital too, but it's a collaborative work. But but on the other hand, if it's not very useful, or not easy to use, it's not going to help to improve too. So that's why the digital health is kind of part of the collaborative work where everyone has to be part of that. So public health also need to be active part of the digital solution in co-designing. So whenever someone is designing a solution, we need to involve everyone, from technical, from clinical, public health, business management and all.
Oke,
I
thank
hope-
you. Ya,
Yeah.
ya, gimana? Udah menjawab. Oke. Ya, so jadi tadi Dr. Usman menjawab bahwa di beberapa negara sebenarnya sudah mulai ke arah seperti di Satu Sehat ya Bapak Ibu. Di Australia sudah mulai dikembangkan aplikasi, cuman memang belum diimplementasikan seperti di Thailand, seperti di Taiwan, maaf. Di Taiwan. Jadi harapannya nanti melalui aplikasi mobile ini kita bisa memberikan promosi kesehatan atau apapun secara personalized ya, termasuk di dalamnya ada edukasi dan sebagainya. Dan di dalam aplikasi ini diharapkan nantinya tidak hanya tentang medication, tapi juga preventif ya, preventionnya. Kemudian ada perubahan perilakunya, healthy behavior, dan juga bisa misalnya, jadi tidak hanya mencegah juga, tapi bisa misalnya mencegah untuk lebih parah, atau bisa misalnya dengan memberikan edukasi kepada orang-orang misalnya seperti DM ya, mereka yang punya keturunan DM kan punya risiko yang lebih tinggi, maka bisa punya atau mendapatkan edukasi yang lebih personalized untuk mereka. Nah, ini perlu aktif juga dari partisipasi kita ya. Intinya kalau misalnya masyarakat nanti mendapatkan benefit atau manfaat dari aplikasi ini, tentunya nanti akan banyak sekali digunakan aplikasi ini. Seperti itu. Oke, ada lagi Bapak Ibu pertanyaan dari yang lain? Any other question? Okay, so if there is no question, maybe I want to ask you about as mentioned before that Indonesia is initiated healthcare transformation in 2022, is the last year, including the digital health transformation. Now, from several key strategies you have mentioned, approximately how long would it take for all healthcare facilities to fully implement digital health based on your experience in Taiwan and Australia? So in Indonesia, we have planned that this year, Indonesia want to implement EHRs for all of the healthcare facilities, like in hospital and primary healthcare. But as we know that in the primary healthcare, maybe there's some difficulties to implement the EHRs. So so how long will it take for all healthcare facilities to fully implement digital health for your experience?
I think it's a good question, but very difficult to answer at the same time. The reason is because it depends on the different region, as I mentioned, because like for example in Taiwan, the people, they already have in the undergraduate level in the medication, they the one who are studying medicine or working in healthcare, they were learning that technology in their schools, right? But in some of the universities, we don't have that. So if someone is graduate doctor and coming to the hospital and just suddenly have the EHR, they need to spend some time to learn, right? Compared to similar challenges in other countries too. So it depends on how much they are well versed in technology, how much they have appetite to learn, and based on that they can able to get. And that's why we need to incorporate the digital technologies curriculum into curriculum as well to healthcare, to understand, to let them know what is the technology will look like, because that is going to be future, and we have to embed technology in everywhere.
Okay, thank you so much. Okay. Is there any question from other participants? If you have question. Okay, there's no other question. So Dr. Chahya, can we close this event for today's event?
Okay, Pak Dion.
Yeah.
Thank you for the moment, and thank you for Prof. Usman for your material, for your experience, for your time, especially to give us the information and the knowledge about the digital health in healthcare. Okay, I think this is very interesting, and how you tell about your experience very interesting for me. Yeah, I think we can follow what your tell today, and for the time, I said very thank you. And we can close the.
Okay.
Okay, thank you.
Okay. Yeah. Okay. Thank you, Dr. Chaya. Maybe, Dr. Usman, you have maybe the closing statement or anything.
Oh, I would like to say thank you all for having this opportunity from me, and terima kasih.
Okay.
Inshallah, next time.
Yeah, you're welcome. Yeah, okay. So, okay, once again, our heartfelt thanks to Dr. Usman Iqbal for your invaluable contributions. We appreciate your time and insights during this event. I extend my gratitude to all participants for your active involvement in the session. As the moderator, I want to express my gratitude for your participation. If there were any shortcomings during this event, I apologize, and I hope we can have another opportunity to meet in the future. Thank you. We can close this event. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you.
Waalaikumsalam. See you.
Yes. See you. Okay.
Ya, terima kasih Pak Dion yang sudah menjadi moderator. Untuk teman-teman semua mahasiswa. Sebenarnya ini bisa ditindaklanjuti ya untuk beberapa tulisan-tulisan yang bisa muncul ya, yang masih galau membuat tema tesis bisa meneliti juga berkaitan dengan pemanfaatan digital health ya di fasilitas kesehatan, bagaimana persepsi penerimaan para dokter, para pasien ya, di fasilitas kesehatan rumah sakit maupun di puskesmas. Ini juga bisa menjadi hal-hal yang menarik untuk diteliti sebenarnya. Jadi tidak hanya pada sisi kepuasan pasien saja, tapi ini kan sudah era digital ya. Kita mencoba tadi misalnya di pertanyaan Sofi tadi ya, itu juga menarik juga. Jadi bagaimana kesiapan dari rumah sakit di dalam penerapan One Health itu juga menarik ya. Baik, saya kira itu yang bisa kita diskusikan. Nanti materi akan di-share juga melalui WA group ya. Seperti itu. Oke, terima kasih Pak Dion.
Terima kasih.
Ya, saya kira kita bisa akhiri. Selamat sore. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Oke, baik. Izin live teman-teman semua.